comes. Imagine another scenario wherein you keep an object or you place a patient in front of the X-ray tube so that when you switch on the X-rays that pass on either side of the uh, object, they will result in complete blackening of the film, whereas there will be a certain set of X-rays which will pass through the object or that will pass through the patient, and these X-rays will be partially absorbed. So this results in reduction in the intensities of the X-rays. So these X-rays with a lesser intensity, they will hit the film and they will cause a lesser degree of darkening of the X-ray film. Okay, so what you see at the periphery is black because this is the maximum intensity of the X-rays, whereas what you see in the center, these are attenuated X-rays, and hence the shadow which we see over here is slightly lighter or depending on the density of the object. Okay, so when you look at an X-ray chest, there will be a large number of shades of grays depending on the density of the anatomical structures within the chest. Okay, so if you see, the bone is going to look the brightest because of its increased density. So this density, what it will do is when the X-rays hit the bone, it will cause maximum number of absorption or attenuation of the X-ray beam, and there will be lesser amount of X-rays going and hitting the transparent screen. Hence, there will be lesser blackening. That's why the bones are going to look the brightest or the most radiodense that we say. Following that, you have soft tissue and fluid. So soft tissue is less dense compared to bone, and fluid is less dense compared to soft tissue. So when we're talking about soft tissue, I'm talking about the mediastinum, I'm talking about the heart, the liver, the muscles of the chest, and when I'm talking about fluid, it also includes the vessels, it also includes the heart, and so on. So most of the pathologies that we see, they will be having a density which is similar to that of the soft tissue and of that of the fluid that we see. Coming further, you will have fat which will have a dark gray appearance because the density of fat is much lesser than that of the fluid or the soft tissue, hence it will appear dark gray. And the least dense structure is the air. Air hardly has any density, hence it will not absorb any of the X-rays, and most of the X-rays that pass through air are going to cause blackening of the X-ray. Hence, if you see that the lung fields that we see are appear black, whereas the mediastinum, the heart, the liver, and the chest wall, they all have varying degrees of soft tissue density because they kind of attenuate the X-rays which pass through the body. Okay, so basically what we're looking at is we're looking at a soft tissue in the background of black tissue. Okay, or we're looking for soft tissue pathology against the dark lung parenchyma. Now, it's very important that you realize how an X-ray is taken. Typically, an X-ray is taken in a PA position, that is posterior to anterior. The X-ray tube is posterior to the patient. The patient stands uh, touching his or her chest to the cassette, and there is a distance of 6 feet between the X-ray tube and the film. So what we do is we ask the patient to take in a deep breath, and the X-rays are emanated from the X-ray tube, and when they fall on the X-ray cassette, they result in formation of an X-ray. Okay, so this is the final X-ray that's going to look. So this is your normal chest radiograph that we see, and you will see varying amount of densities. You see the bones which are the most dense, you will see the heart and the mediastinum, uh, these are the pulmonary vessels, this is the liver, and so on. Okay, So before we embark on interpretation of the chest radiograph, it is absolutely essential that we know a little bit about the anatomy, because if you know the anatomy, you will know what you're looking at, which area you're looking at, and it's a great idea to have a little bit of knowledge about the pathology as well. If you know your anatomy and pathology, interpretation of chest radiographs, or for that matter any radiological investigations, becomes much more easier. So what we're looking at, uh, the chest radiograph is broadly divided into the lungs and pleura, all right, on either side. So this is the right side, that's the left side. So that's the lungs and the pleura, and whatever is between the two lungs is the mediastinum. Having said that, the normal pleura is not visualized on the X-ray chest. Okay, it's not visualized unless the pleura is thickened by some pathology. So if you look at it closely, this is the lung. All right, it appears black because the normal lung contains air. Air does not absorb any X-rays. So most of your X-rays are going to pass through the normal lung, and it's going to result in blackening of the film. Whereas the X-rays passing through the mediastinum are going to get attenuated, and they're going to cause less darkening of the film. So over here, if you see the hilar vessels, they absorb lesser amount of X-rays, hence they're looking dark gray. But if you see, because of the overlapping structures, there is more absorption of X-rays, hence this area appears bright. So this is the these are the lungs, and this is the this is the pleura covering the lungs, all right, and whatever in between, that is your mediastinum. Now some people do consider heart as a part of the mediastinum, and just for the purpose of description, we will do so the same over here. So you have seen the lungs, you've seen the mediastinum. So how do we look at the chest wall? So we should know how to count the ribs, because the ribs go in a curvilinear fashion. So this is 1, this is 2, 3, 4, 5, 6, 7, 8, 9, 10, and so on. It's a good idea to count the ribs from the back to front, so that if you're trying to look for any fractures, or if you're trying to localize a lesion, it's much more easier to do it this way. Okay, so this is how we look at the ribs. Make sure you count them, you trace all the way from the back to the front. Initially this is going to take a little bit of time, but once you start doing it more often, it's going to be much more easier. It's important to count the ribs, because suppose if you have to label an X-ray, if you have to label a rib fracture, it'll be easier for you to say, all right, you know, the seventh rib is fractured, or the eighth rib is fractured, and so on. It'll be easier to pinpoint the pathology. Apart from that, we also look at the soft tissues which are outside the ribs. All right, so this is the fat that we see, this density that we see, this is the musculature, and of course, you know, these are the breast shadows that we see over here. After looking at the chest wall, what we do is we look at the mediastinum. All right, mediastinum has a lot of structures, so it's a great idea to know what are the structures which are involved in the mediastinum, which are present in the mediastinum, which is your trachea, your esophagus, uh, the thymus, the lymph nodes, and so on. So how do we know which are which structures? So if you look at this radiolucent stripe over here, that is the trachea that we see. Okay, the trachea bifurcates into the right bronchus and the left bronchus. So this area is known as the carina. Even if you are unable to see the structures of the mediastinum, it's a great idea to know what are the boundaries of the mediastinum. So if you see any pathology which is causing distortion of these boundaries, you can at least think of the possible structure involved. So over here, okay, so this is the trachea that I just described. These are the outlines. So on the right side, this purple line demarcates the right upper boundary of the mediastinum, and that is formed by the superior vena cava. The right heart border is formed by the right atrium. The inferior border of the heart is formed by the right ventricle. The left heart border that we see is formed by the left ventricle. Okay. Uh, so above the left ventricle, there is this little bump that you see, that's the left atrium, and above the left atrium, what we see is the aortic knuckle. Okay. So how do you look at the aorta? So this is the aorta, and you can actually trace its lateral margin all the way posterior to the heart. Okay. So uh, this is the shadow of the aorta that we see over here. Okay. So let me repeat this once again. The right upper border of the mediastinum is formed by the superior vena cava. Right heart border is formed by the right atrium. Inferior border is formed by the right ventricle. The cardiac apex and the left border of the heart is formed by the left ventricle. Above that you have the left atrium, a small bulge, and above the left atrium what you have is the aorta. So now that we're done with the mediastinum, we look at the hilum. We often read in the reports that the hilar prominence or the hilar shadows. So where exactly are the hila? So the hilum is over here. Okay, these green areas, these are the hilum that we see. So what are the structures that we see at the hilum? So the structures which are routinely present are the blood vessels that we see over here, the bronchi that